As a liver health specialist with more than 2 decades of experience, I have observed a troubling pattern among older adults across cultures and lifestyles. Many seniors unknowingly strain their liver every day by consuming one common food: refined sugar. This sugar does not come from your sugar bowl. It hides in processed foods like flavored yogurt, fruit juice, granola bars, cereals, salad dressings, sauces, and low-fat snacks. These hidden sugars create a constant burden on the liver, especially in seniors whose metabolism is slower and who are often less physically active. The liver works quietly behind the scenes to detoxify the body, regulate blood sugar, produce, bile store nutrients, and break down fats. But when it is overloaded with refined sugar, it begins converting the excess into fat through a process called de novo lipogenesis. Over time, this leads to fat buildup inside liver cells. This condition is known as non-alcoholic fatty liver disease, and it is now one of the most common liver problems among seniors, even those who have never touched alcohol. Fatty liver disease often develops silently. There are no sharp pains or obvious warning signs in its early stages. Most seniors with fatty liver feel fine until symptoms like fatigue, digestive issues, or abnormal blood test results appear. That is exactly what happened with Robert, a 71-year-old patient of mine, who ate what he thought was a healthy breakfast cereal with sweetened milk fruit juice and flavored yogurt. After imaging showed moderate fatty liver, we removed the added sugars and replaced his meals with plain yogurt, whole fruits, and oats. Within 3 months, his liver enzymes improved and his energy returned. Refined sugar overwhelms the liver because it floods the bloodstream quickly and must be processed rapidly. This is very different from complex carbohydrates like oats, which break down slowly and provide steady energy. Excess sugar also worsens. Insulin resistance raises triglyceride levels and increases the risk of heart disease, all of which are already common in seniors. It is not about eliminating all sweetness. It is about identifying hidden sugars and giving the liver a chance to rest. When sugar is removed from processed foods, the liver regains its rhythm and supports the entire body more effectively. One of the biggest problems with refined sugar is that it often hides in foods marketed as healthy. Seniors trust brands they have used for decades. Many of them grew up in a time when sugar was advertised as energizing and when low-fat labels became trendy. But to keep flavor, manufacturers quietly replaced fat with sugar. This shift filled supermarket shelves with low-fat yogurts, fruit juices, cereal bars, and sauces packed with added sugars. Many older adults eat these foods daily, and because they are not desserts, they assume the sugar content is safe. A single serving of flavored yogurt can contain more than 5 teaspoons of sugar. Over time, this daily intake becomes a silent metabolic burden. The body does not feel sugar damage in the same way it feels a headache or joint pain. Instead, sugar creates slow, steady harm to liver cells, increasing fat storage, disrupting insulin response, and promoting inflammation across the body. In seniors, the problem is amplified because liver regeneration slows with age. That means the liver cannot repair itself as quickly as it once could. So even a moderate intake of sugar, if consumed daily, becomes a chronic assault. Over the years, I have treated hundreds of seniors with fatty liver who had no idea their breakfast choices were the cause. A typical case is cereal, sweetened with dried fruit and honey, plus juice and toast with jam. That is more sugar than the liver can manage, and all before noon. Even slim or active seniors are not immune. Fatty liver disease is not always linked to weight gain. Many of my patients with liver damage appear healthy on the outside, but have diets high in sugar. They often focus on calories and fat, but ignore how certain foods affect their metabolism. To heal the liver, seniors must look past labels like low fat or whole grain. Instead, they should read ingredient lists and search for hidden sugars like high fructose corn syrup, cane, sugar, fruit juice, concentrate, dextrose, and maltose. By removing these daily threats, the liver can reduce stored fat and recover its ability to detoxify balance hormones and support digestion. Change begins not with restriction, but with awareness, and that awareness is what saves lives. Excess sugar does more than harm the liver. It increases inflammation throughout the body, worsening every major chronic disease that affects seniors. When the liver becomes inflamed by sugar overload, it releases harmful molecules called cytokines. These chemicals travel through the bloodstream and irritate joints, muscles, blood vessels, and even the brain. Many seniors suffer from joint stiffness, memory, fog, fatigue, or digestive upset, and assume these are simply signs of aging. But often, these are symptoms of systemic inflammation rooted in poor liver health. Addressing sugar intake and supporting liver function has helped many of my patients reduce those secondary symptoms and improve their overall quality of life. The liver also plays a major role in controlling blood sugar. When overloaded with sugar, the liver becomes resistant to insulin, a condition known as hepatic insulin resistance. This condition drives blood sugar levels higher, promotes fat gain around the abdomen, and worsens the very diseases seniors are already at risk for, like type 2 diabetes, high cholesterol, and hypertension. I once treated Linda, a 76-year-old woman managing borderline diabetes without medication. Her labs revealed rising insulin and liver enzymes, even though her diet appeared balanced. After review, we found she drank daily fruit smoothies with banana, orange, and apple juice. These smoothies, which she thought were healthy, delivered over 40 grams of sugar every morning. Once we switched her to green smoothies with leafy vegetables, berries, and unsweetened almond milk. Her fasting insulin dropped, and her liver enzymes returned to normal in just weeks. The danger of sugar is that it does not cause immediate pain. It creates slow internal damage. The signs appear gradually. Fatigue, bloating, skin problems, poor sleep, and are often treated with medication rather than diet correction. This delays healing and leads to unnecessary drug use and side effects. The liver needs rest, not pills. When sugar is reduced and fiber is increased, the liver begins to recover. Energy returns. Hormones stabilize. Seniors feel lighter, clearer, and more resilient. That is the power of small dietary changes. They heal not just one organ, but the entire body system. For many seniors, the signs of liver overload are easy to miss. Fatigue, poor appetite, swollen ankles, brain fog, dry skin, and poor sleep are often dismissed as signs of aging. But these symptoms often reflect liver strain caused by years of silent sugar consumption. The liver does not complain loudly. It whispers until it cannot keep up. Standard checkups often miss early liver issues because advanced imaging and liver-specific blood markers are not routinely used. As a result, many seniors carry undiagnosed fatty liver disease for years. By the time a diagnosis arrives, the liver may already show signs of inflammation or fibrosis, both of which increase the risk of cirrhosis and liver failure. But the good news is this: the liver has an incredible capacity to heal, even in older adults when sugar is removed and whole foods are added. Liver cells begin regenerating. One of my patients, an 80-year-old retired teacher, had chronic tiredness and rashes. She took multiple medications, but nothing worked. Her breakfast included flavored oatmeal, sweet tea crackers, and jam. After shifting to plain oats, fresh fruit, and herbal tea, her symptoms faded within 6 weeks. Her liver enzymes also improved dramatically. It is important to understand that sugar damage can occur even in people who appear thin or eat moderately. The real issue is not how much food is consumed, but how often refined sugar enters the bloodstream. Sugar forces the liver to divert energy from detoxification to sugar processing. This means other liver functions like hormone regulation and bile production slow down. The result is a cascade of small issues that worsen over time. But when seniors begin cooking at home using real ingredients, drinking more water, and avoiding sugary beverages, they gain control. These simple shifts reduce liver inflammation, improve digestion, and promote better sleep. Seniors regain vitality not from medication, but from their plate. The liver does not ask for much, it asks for rest. And when sugar is removed from daily routines, that rest is finally possible. The most hopeful truth I share with seniors is this: it is never too late. The liver responds quickly to better care. Even small changes in diet can reduce fat in liver cells, lower inflammation, and restore metabolic balance. And none of this requires expensive supplements or complicated programs. Start with beverages. Remove fruit juices, soda-sweetened tea, and energy drinks. These are major sugar sources absorbed rapidly and without fiber. Even 1 cup of juice can deliver more sugar than 2 whole oranges. Replace these with herbal teas, lemon water, or water infused with cucumber or mint. Hydration without sugar gives the liver room to heal. Next, focus on breakfast. Skip the sweetened cereals, instant oatmeal, and low-fat yogurts. Instead, eat steel-cut oats, plain Greek yogurt with fresh berries, eggs, or avocado. These foods provide energy without overwhelming the liver. Check every label. Hidden sugars include high fructose corn syrup, maltose, dextrose, cane sugar, and fruit concentrate. These appear even in savory foods like salad dressings or pasta sauce. Cooking at home allows full control and reduces exposure to sugar additives. Increase fiber. Fiber binds toxins and supports regular elimination. Beans, vegetables, whole grains, and seeds help clear the liver's waste. Most seniors eat less than half the recommended daily fiber. Fixing this is one of the best things anyone can do to detoxify the liver naturally. Support restful sleep. The liver does much of its repair work at night. Try sleeping earlier, limiting caffeine, and eating dinner at least 3 hours before bed. A quiet, regular sleep routine strengthens liver rhythm and hormonal balance. Lastly, encourage community. Seniors who cook with others, join wellness groups, or simply share their progress with family feel more supported and stay more consistent. This journey is not about perfection. It is about steady, conscious choices. A patient of mine, age 83, began this journey skeptically. 2 months later, he had better energy, smoother digestion, clearer skin, and normalized liver tests. He said, "I feel 10 years younger just from changing breakfast." That is the power of knowledge, consistency, and care. If you found this message valuable, please subscribe, comment, and share it. One daily habit can restore the liver, and with it, your vitality for years to come.